100 years, Our Lady's Hospital in Navan has been a properly staffed, high-quality, functioning hospital. It has given health services to those people, despite income and despite age. In other words, it provided, if you like, universal health care. Even in the toughest of times, this happened. Now today we live in a county with 160,000 population. That population is higher than at any point than over the last 100 years. We in Meath are actually net contributors with regards to tax in this country. That is, we pay more to the government than we receive. Yet, however, in most issues, we are at the bottom rung of what we're entitled to in this county. Now, today we're here for one reason. We're here for the reason of healthcare. We're simply asking for a properly resourced, patient-centred health service delivered locally for the people of Meath, similar to what has been delivered here in Navan Hospital for decades. There are hundreds of people walking the streets of Navan. Indeed, there are people here today who would not be here only for the services of Navan Hospital. So what has happened to our hospital? First of all, over the last number of years, paediatric services have been lost. Maternity services have been lost. Orthopedic services have been reduced and suspended for months on end. The HSE has cut budgets year after year. Blood testing is now outsourced. Interns have been removed. Surgeons have been removed and indeed suspended. Training recognition has been withdrawn. Keyhole surgery has been cancelled. The doctor on call service has been cut. And it's been announced by the HSE that the A&E services will be transferred to Drogheda. And now all acute services will be cancelled. This means fewer anaesthetists, fewer nurses, and ultimately the end of surgery for Navan. Because of the hatchet job carried out by this government, Navan Hospital, as we know it, may cease to exist. Now bear in mind, during the last election, Minister Dempsey promised, and I quote, to go to the wire for the county hospital. However, just last week, when he was asked about the latest cutbacks, he said, I'm completely unaware of what's happening. Now it seems that little Lord Dempsey, while he's swanning around in his helicopters and luxury jets, is happy to let the sick people of Meath hitch a ride to Drogheda for services. Now, we've been told that the cuts in the HSE are actually for our own good. We're told that they're for patient safety. Well, tell that to the men and women who are working below ground in Tara mines. Tell it to the hundreds of emergencies that will pass this hospital by in the coming years. Local doctors in the last week have spoken with passion and energy with regards what is happening here. Their attitudes is that these cuts are putting patient safety in jeopardy. Meath has the lowest provision of doctors in the country, and not a single one of the 12 primary care teams promised for Meath has been established. Now, do you remember recently we had a promise of a regional hospital? Well, that promise too, like snow off a ditch, has disappeared. Navan was selected as the site for that regional hospital. Dermot Ahern, Fianna Fáil Minister and TD for Louth, stated there would not be a penny for it. With our so-called representatives, it seems that Meath is not even getting the scraps off the cabinet table. Now, the abuse of language and the Machiavellian acts of the HSE is a sight to behold, other than if you're in the wrong end of it, like we are here in Meath. They twist and use language to their own benefit. On one hand, they're talking and preaching about patient safety, and at the same time, 500 people are waiting on trolleys around the country. The HSE twists the truth. First of all, they tell you that Navan Hospital is fine. There is no danger. Then they cut resources, leaving staff to struggle with provision. Over time, prolonged under-resourcing inevitably leads to fall off in service. But the HSE then used this as an excuse to seek further cuts. When the hospital struggles to function, the HSE then comes in and closes it down. This is a disgrace for a number of reasons. None of these service closures were supposed to be implemented until the necessary investment had been made in the hospitals locally for overflow of patients. However, no investment has been made in these neighbouring hospitals. People from Meath will spend longer on waiting lists and will be forced onto trolleys in hospitals already full to the gills. Indeed, due to the pressure on Drogheda, it has been consistently rated as the worst hospital in the state. The closure of services in Navan Hospital are not for patient safety, they are a threat to patient safety. I'm calling here today, in the interest of patient safety, that Navan Hospital should remain open. In the interest of patient safety, that the HSE should be closed down. We are told that there's no money for hospitals, that we have to cut back. But 24 billion is being bailed into the stockholders and investors of Anglo-Irish Bank. This money is being wasted on Anglo, would actually pay for 48 regional hospitals around the country. Think about it. The money on Anglo alone would pay for 48 regional hospitals throughout the country. It should be stated at this point that the robbery of the money from our health services has actually paid for these banks, and it is an example of the corruption that is at the centre of this government. And to top this off, the very people implementing the cuts, the HSE administrators, are seeking 5% pay increases. It should be stated at this point that the terrible state of our hospitals is not a reflection on hospital staff. If it were not for the heroic efforts of the staff, the situation would be immeasurably worse. Medical staff have carried the burden left by this government for years, and again they will be expected to clean up for the mess left behind from Navan Hospital. So what do we do? What do the people of Meath do? It's easy to feel helpless in situations like this. It's easy to feel that it's a done deal. But we, the people of Meath, have a responsibility to ourselves and to our children to stand up and be counted. To get services in this country, you have to shout loud. This week is not the end of Navan Hospital. This week can be the start of a campaign to save it. We in Sinn Fein have put the work in here to get this campaign started. But we're now asking every other organisation in Meath to join with us in a broad coalition of community groups, local organisations and clubs to grow this campaign until it's heard loud and clear at the Cabinet table. We would like to extend an invitation to the staff of Our Lady's Hospital, past patients, people working in businesses, factories, staff in local areas, staff at Tara Mines, union members, church leaders, schools. Get behind this campaign. Give the people of Meath a voice. At the end of today's events, I'd like people who are interested in getting involved in the campaign to come up to the front here. We'll have people with pens and papers to take their names and details, and we'll give people like yourselves a call over the next week. We'll make contact with you, and we'll hold a public meeting in one of the hotels in the town, and we will form a committee. Roscommon brought 8,000 people on the streets. Letterkenny, Nina, Mullingar and Dundalk have all organised mass campaigns to support their hospital. Meath has stayed silent too long. We have a choice. We allow the slow death of our health services, or we get up off our knees and fight for the hospital. Rally.mov.